Good afternoon, everyone. My name is Catherine Turner. I'm one of the executive managers at the Hunter New England Central Coast Primary Health Network. Thanks for taking time out of what I'm sure is a very busy day for you today to get a bit of an update on cluster management and preparedness from our teams. As always, I'll begin by acknowledging that we're meeting on Aboriginal land wherever we are today. Acknowledge elders past, present and emerging, acknowledge their ongoing connection to this beautiful country where we live and work. We will have a series of very quick, 3 quick presentations today just to try and give you some information and keep you up to date as best we can. There's always the opportunity for questions via the chat, which you can see over to the right of your screen, or I can see to the right of my screen, so hopefully you can. And there will be a poll at the end. We're really interested in your feedback. We want to make sure that these sessions are useful for you, and so as much information as you can get to us would be great. Sandra Fitzgerald from our Health Pathways team is driving the slides. So Sandra, if you wouldn't mind slipping to the next one, please. Okay, so today's learning objectives. How can the PHN support you through COVID-19? Or Sandra, I can't see it. What happened then? Oh, thank you. Helping to identify priority actions for pandemic preparedness and review and implement systems to identify gaps. And I know everyone's been doing a lot of work in this space already, so this is just another in a series of those. So Sandra, I'll move to the next one. So a bit of an overview. We've been refining our emergency response and support. As you know, we did have a small cluster of community transmission cases last week, so gave us the opportunity to stand up the Emergency Operations Centre and further refine our processes. There's an email there for any concerns that you have that you think are at an emergency level. And you can always contact the PCI teams as you already do, but that email now is being monitored much more frequently, and we can help you with anything that's needed there. PPE requirements. This isn't getting any easier, and I know there's some comments later in the slides about New South Wales Health's surprising move to an amber alert last Friday. So there's a couple of things that we have been doing. We've obviously there are masks that you can order through the portal. I believe someone's going to cover this in more detail, but we are delivering masks. Our PCO teams, where I am, are out in the rain, making sure that they're getting things out to the practices and allied health providers that need them. We're also gathering lists of alternate suppliers. We know that sometimes things like gowns, gloves, goggles, face shields, they're difficult to come by from sometimes from your normal supplier, as the supply chains become disrupted for various reasons. So on our website, we have gathered some alternate suppliers, and you can also just email us and we can let you know where they are. So if you're having trouble getting hold of anything, cleaning products, hand sanitizer, we do have a number of other places you can potentially try. We're also purchasing some equipment to make sure that we've got enhanced supplies on hand in the event of an outbreak, so that we're less reliant on the national stockpile or on other providers, and we want to make sure that we have some stock in the region that we can mobilise as needed. We're also running a series of webinars. Last night was the 11th in the series of COVID updates, and we're now we've also run some more specific ones. This is another example of that. Alison tells me this morning we've had 11,500 people attend various COVID-related education sessions since March, which is astounding. So always let us know if there's something else that you think you need to know. We've got good links with lots of specialists and others, and we can make sure that we're keeping you up to date. One of the things, I'm just been watching the news out of Melbourne today. It's absolutely heartbreaking what's happening there in residential aged care. We're really keen to reassure practices that we've been doing a lot of work with the local health districts, with the New South Wales Ambulance. We've been advised by some GPs on where the emerging issues are, and also working closely with the aged care providers to make sure that we are covering off as many of the things as we can to assist them in being prepared for potential outbreaks. And that includes things like PPE training, infection control training in general, making sure that they've got very robust plans that are available to be mobilised if there is an outbreak. And that includes doing some work with them around communication. One of the biggest challenges in an outbreak for anybody is how we're going to communicate what's going on and make sure that everybody's kept informed. And the stories coming out of Victoria today, a lot of them relate to poor communication, as well as some pretty sad practice. So we're trying to make sure that the aged care facilities are very much better prepared here as best we can. We're also mindful that whilst that work has happened, we haven't really told the practices or others a lot about the detail of that. So we're just getting some comms together. So we'll put some information in the next update so you'll know what it is that we've been doing with aged care and how we hope to avoid some of the things we've seen overseas and in other parts of Australia. Telehealth, huge change in practice for us in terms of telehealth. So the PHN has been really engaged in that, continues to be. We've lobbied the government for extension of the MBS items. We're continuing to be in touch with them around some of the detail around that and what should look better. What could work better in practice. And as always, keen for your feedback on what would be helpful in regards to telehealth. I believe there are now some orders for equipment being made via the portal that we've got on our website. At the peak of the first outbreak, people were unable to access some of the equipment that they needed, and we know that that's now being addressed. So yeah, please reach out and let us know if you think there's some equipment that you need that you can't get hold of through, again, your normal suppliers. And we've got some good access through our IT supplier for things like webcams and headsets and all the things that actually make telehealth much more doable. In response to cluster outbreaks, we've had a bit of, as you know, we've had that small and, I don't even want to say, no, I won't, but small outbreak at Port Stephens. We have no news of any new clusters. Enormous numbers of the community have come forward to be tested, which is just so reassuring. But we know that over the weekend, we had pathology labs who were prepared to open and increase their pathology testing, but they needed, obviously the patients needed GP referral if they're not going through the New South Wales health testing system. So we were able to reach out to some of the practices and offer one-off grants to increase the hours of opening in response to an outbreak. And really want to thank the practices who cooperated in extraordinary short notice to do that. But it's just something else we'll put in the toolkit for if there is an outbreak. This is something that the PHN can do to help. Sandra, if you want to move to the next slide, please. So you've heard us talk about Capacity Tracker a lot. We're really pleased that I think about just over 50% of the practices are now got their information into the Capacity Tracker for us. This isn't, we're trying not to make this an additional load on anybody, but this is a really important tool for us to be clear about a bit more information about the practice, about any impact of COVID, about who is the emergency contact, who we might be able to, we're just going to have a look at whether there'd be value in putting some of those emergency contacts into a Whisper SMS system so that if things change, we can respond quickly and let you know. So for example, if there's an outbreak and there's a new clinic opening nearby, we could, text the emergency contacts and let you know that. So as soon as we find out. So we would really encourage you to have a look at that, register if you haven't, keep the information updated if you can. It obviously is a quality improvement piece for you, but it also helps us answer the question. Sandra, if you go to the next slide, please. Answer the question of if there's an outbreak in a residential aged care facility, which GPs are usually looking after that facility. It seems odd, but that information isn't easily available. It's a relationship between that patient and that GP. So we don't know when that's disrupted until it's disrupted, and we have facilities reaching out to help us. And equally, yeah, if there's a practice that's implicated, impacted and unable to provide support to residential aged care, we need to know that as soon as we can, so we can again make sure that the patients in that facility are being cared for while others are unable to continue with that care if it's for a short period of time. We've had some success where we've been able to look after, get some emergency assistance in, and these are just things that we're preparing for when future outbreaks occur. So please have a look at that. You can also let us know about mask supply or other issues that you're having, if there's any significant changes in the practice, and we're getting alerts through that system every day, and every day we're using that as a means of contacting people and saying, what's going on? Are you okay? How can we help? And I'm really pleased to say they're all being responded to on the same day. So hopefully that's helping. It's an emerging system, something we're trialling right now, and we're really hoping that that will be of assistance to you. So speaking very quickly, I will hand over now, I believe, to Sandra Fitzgerald, who's one of the clinical editors from our Health Pathways team. And I'll thank you all and sign off from here. Thanks.
Thanks so much, Catherine. That's terrific. So I'm here to talk very briefly about Health Pathways, both on the Central Coast and the Hunter New England site. All the information I'll be showing you is identical across the both sites, but it just might look slightly different Central Coast when you get onto your page, just because of the way it's formatted. And what we're saying as a PHN is that Health Pathways is the single source of truth. We have a team of clinical editors that update the pathways daily, and over March and April we were sometimes updating them every hour as new information came out. So when stuff comes in, you can usually, or hopefully, find it somewhere on Health Pathways. And even though it's primarily used by GPs and practice nurses, there's a lot of very useful information for admin staff and practice managers. So I encourage you to have a look around on your site and have a look at what's there so that you can access it readily when you need it. If there's anyone out there that doesn't actually have the login details, just contact your PCIO and they'll be able to give you the login details. So this is what the front page of the Hunter New England Health Pathway looks like. I'm sorry, my camera doesn't seem to be focusing on me for a minute, so I'm sorry that I'm all blurry there. But the things that so the information I'm going to give you is the things we've been asked about frequently. And what people are wanting to know is, where's the latest information on things like travel from Victoria? What are the latest COVID case locations in New South Wales? And when you click on that link, that's a New South Wales health link that gives you all the locations in New South Wales where people need to go into self-isolation for 14 days, and then a second list of locations where people need to monitor the symptoms and get tested if they occur. So that gets changed pretty much daily, so that's a good one to keep on top of, particularly for your triage information when people are phoning to come into the practice. In Hunter New England, we also have this public health alert for those cases in Port Stephens. That is not on the Central Coast site. This information is also on the clinical editor's notes, which is at the top of every COVID-19 pathway. So you can see they're highlighted there again, and again, the Central Coast won't have that Port Stephens information. So now I'm just going to show you how to get onto those COVID pathways once you're on the site. You can either click on the Follow the COVID Pathway Pages link, or on the left-hand side in the table of contents, if you click on COVID-19, it will open up all the relevant pathways. Now, the ones I'm just going to show you in green now are the same across Hunter New England and Central Coast, and these are the ones I think you should probably have a look at. It's the practice management pathway, the initial assessment and management pathway, which is all around if someone thinks they might have COVID. So this is not for someone who's got confirmed COVID. The information page and the MBS item and referral page. So just looking first at the initial assessment and management page, one of the questions we get asked frequently is, where can I find the latest self-quarantine or home isolation criteria? And it's right here in assessment 3. If you drop down that box, that's kept very up to date. That's probably the first thing I check at 4:30 every morning to make sure there's nothing extra I need to add there. And then on every page, the green highlighting around that text, looks like a speech bubble, that's where you can send feedback. And please can I encourage you all to send feedback at any time when you think something's not right, or something's missing, or there was something you were hoping to find on the page that you didn't, or you think a link's broken. We we've all got our eyes on these pages, but the more eyes, the better, please. And the practice management page is probably the one that's most relevant to most people listening to this webinar today. I've highlighted a few things on there. You can see at the top the last updated date, that was yesterday. So just proving that we do update the pathways regularly. And what was added was this information around the Amber Alert. So we've got the links to the New South Wales Health Amber Alert, and we've also got the corresponding RACGP advice, because the advice did come out for New South Wales health staff and facilities, but the RACGP have now given out over the weekend advice around how that applies to general practice. Some other things you'll find on there are the latest infection control and PPE advice, because particularly over the initial start of the pandemic, this was changing daily. So that will give you the links to the latest things. There's posters, resources, a few things around care delivery. But the thing we're also getting asked a lot about is guidance for staff around what to do, you know, once they've got respiratory symptoms or a temperature and they have a negative COVID test. And we have just added under staff behaviours a section on what the New South Wales health guidelines are. And currently, if anyone's got respiratory symptoms, fever, or loss of taste or smell, they obviously need to be tested and self-isolate. Once they get their negative result, if they aren't one of these people that need to continue self-isolating for 14 days because of overseas travel to Victoria or the specified locations in New South Wales, or they're a close contact, so if they're just your Joe Blow who's not had any of those things happen, they do still need to stay at home if they've got respiratory symptoms until their symptoms have resolved, even following a negative COVID test. And the reason for this is, on its best day, the COVID test has a 20% false negative rate. So that's 1 in 5 tests might be falsely negative. And so it's really important that they stay home until their symptoms are resolved, because if there's ongoing symptoms, it might be that they need to be retested. And there's certainly a section on health pathways on that initial assessment and management pathway around who needs to be retested. The COVID information page has got a lot of the local information. So you can see down here on the bottom left-hand side, it's got the public health snapshot, which is just a picture of what's happening with COVID in our area. It's got the list of private pathology testing collectors. It's got a great GP triage flowchart for, you know, triaging patients in your practice, and that's updated as guidelines update, and it's got that link to the surgical mask request form, and in the bottom left there's also that capacity tracker. Further down the page there's also state and national guidance from places like New South Wales Health, the Clinical Excellence Commission. There's also a large section on Aboriginal and Torres Strait Islander health, and then right at the very bottom there's some international resources that are of interest, and they've got things like the Johns Hopkins University COVID tracker. And then the referral page has got all your information about where you can get people tested. In the top right-hand side, we've got a quick link to the COVID-19 clinic site that's run by New South Wales Health. And when you click on that, that gives you all the current information around the public clinics and the community respiratory clinics. And a lot of the private pathology providers have put their information there as well. The private pathology people don't seem to keep it as well up to date as the public health clinics. And then on the bottom, on the left-hand side, where you can see testing highlighted in yellow, when you click on that, this has got all the information around testing. So it's got the current testing recommendations, testing options based on patients' age. So what you do with kids under 12 months to 5 years, and over 5 years. And then in these drop-down boxes, it's got all the private and public options. Now, this might look slightly different on the Central Coast site, but they'll have something similar. Second last page I'm going to show you is this telehealth page, and that is always kept up to date with the latest changes that come through. But if you're having some questions around telehealth, have a look on there and see if it answers it. It's also got some great helpful information around doing telehealth with Aboriginal and Torres Strait Islander patients, and information around billing, providing prescriptions, pathology requests, and all those sorts of things by telehealth. And then this page is a page that is single source pretty much across Australia. I think that's around the MBS item numbers. And again, this is kept, you know, was recently updated this week with all the changes that happened this week. And at the bottom of this page is a really great section with all the telehealth item numbers and fees and things like that broken down into their different components. So have a little look around that page as well. So can I please encourage you all to familiarise yourself with these pathways? They're, a lot of time and attention has gone into them, and a lot of time is put into keeping them up to date and making sure they are the single source of truth. And please send any feedback that you might have. So that's me. Renee, I'm going to throw over to you now and turn my camera off. You there, Renee? There you are.
Yep. Hi. Thank you, Sandra. You gave us a lot of great information there. I know that they're all questions that we're frequently getting asked in the PCIO team. So to start off with today, I'm going to cover off on the scenario planning tool. So the PHN has developed this to assist general practices to better plan for, respond to, and recover from the impacts of emergencies and disasters. The tool has been designed to assist you identify areas for improvement in your systems and review of your current pandemic planning and emergency response plans. Every practice should have, over to the next slide, Sandra. Every practice should have a copy of this tool by now, so if you are not aware of it, please contact your primary care improvement officer. One of the scenarios that your PCIO will go through with you is staff and direct impact with emergency response. Staff are essentially your most important asset, so it's important to consider their safety by looking at ways to better protect them. You are protecting your practice. By reviewing some of the questions in this scenario, you may ask yourself the following. Does your practice have a pandemic staff policy highlighting risk to staff? An example of things you might consider for this could include, do all staff know how many staff members can safely be in communal areas such as lunchrooms at one time? What are the cleaning protocols and schedules the practice has in place, and who is responsible for them? Have you, as a practice, thought about the cleaning of practice phones or the possibility of having only one staff member use one phone where possible? Do your staff know what to do if a suspected COVID case has entered the practice? Another question to consider might be, do you have protocols in place to protect vulnerable employees such as over 65, those with chronic diseases, or your Aboriginal and Torres Strait Islander employees, as well as a duty of disclosure for such? Due to the limited time today, this is really just a small snapshot of the scenario planning tool, but please contact your PCIO and we can help you review this tool in more detail. So over to the next slide now. This slide talks about general practices and how they have adapted to the changes and limitations COVID has placed on the way they operate and engage with their patients and the community. An example of a few changes that can be implemented are, importantly, number one is make sure that one person is not the holder of all the information in the practice. Make sure your practice systems are well documented and readily available to all team members so that if a key staff member is absent, information is still available. Does your practice have a policy in place for staff who may have to self-isolate or quarantine, covering both clinical and HR issues? You can also refer back to what Sandra showed us earlier about that when you're creating your policy. Have you thought about facilitating a reciprocal relationship with another practice to support each other in the event of staff shortages or worse, practice closure? Another idea may be to consider turning off phones and shutting practice doors over the lunch period to give staff a break and a chance to debrief. It's a really stressful time in general practices, and having a little time out can give staff a chance to regather themselves for the afternoon ahead. When it comes to triage, you need to triage both over the phone and on arrival for appointment. Where you have the capacity, it's a good idea to set up a triage station at the front door, temperature testing, asking about symptoms, asking if travelling has occurred to hotspots, and importantly, asking if they have recently been tested for COVID. We have heard of a few examples lately where patients are presenting to practices after COVID testing, but prior to getting results back, putting the practice and staff at considerable risk. We can't assume that patients know what we know, and some patients won't disclose unless directly asked. While we are out and about, we are seeing many practices that we are going into still displaying old signs. Some still say about patients having recently returned from China. It's important to keep up our practice signage up to date with the current advice. We need to now list patients that have recently visited Melbourne, Sydney, and 4 our local identified potential exposure locations in Port Stephens and East Maitland. So with a resurgence of COVID cases, we need to also increase the frequency of standard cleaning measures. Make sure everyone is aware of what is required and whose responsibility it is. Walk through the practice as if you were a patient and consider all the common touch points throughout the practice. Some practices are now installing sliding doors with a button to open and close. Another thing is ensure your GPs have the capacity to work remotely from home. It's a good idea to test the system out prior to it being needed. The PHN has created a resource to guide you through this. It's also just as important that remote access is in place for practice manager or other key admin members to access practice phones and clinical software for communications and appointments in the event of a practice closure. Lastly, have your staff had training in donning and doffing of PPE. This includes admin as well, both for their own protection if they are required to wear a mask, as well as so they can instruct patients in how to apply a mask correctly when required. They are often the first people that patients come into contact with when entering the practice. There are some great one-pager resources that you can print and supply to your patients for their education. So while we're talking about masks, if we go over to the next page, the PCIO team will once again be doing another delivery of masks over the coming 2 weeks out to practices. But if when you're doing a stock take prior, you find yourself in short supply, as you're no doubt using them much faster than usual, you can place an alert through Capacity Tracker. If you haven't yet registered, you can also order through the PHN website or the link in Health Pathways. As Sandra touched on earlier, and you're probably already aware, New South Wales Health Policy has made changes about staff and patients wearing masks. Sorry, I've just lost my spot. The corresponding RACGP advice for the general practice is RACGP supports the new directive from New South Wales Health for all healthcare workers to wear a face mask when physical distancing of 1.5 metres is not possible. This realistically applies to all face-to-face consultations regardless of the patient's symptoms. The RACGP also advises that wearing a mask supplements but is definitely not a substitute for other precautions such as hand hygiene and physical distancing. We do have an infection control webinar at 7:30 a.m. tomorrow morning, presented by Marg Jennings, microbiologist and infection control educator. If you haven't yet registered, you can still do so through the People Bank Education and Events page. It's a really good idea to keep a close eye on our education page, as the education and events are being put together at short notice due to the rapidly changing environment. Lastly, if you haven't already done so, now may be a good time to review your practice's policies and procedures in relation to the wearing of masks. So over to the next page now. As this is a really stressful time in general practices, don't forget the availability of our Members Assistance Program funded by the PHN. This provides free confidential counselling for work-related or personal concerns for all staff members, and it's available until April 2021. So this brings us to the end of today's presentation. Thank you all for taking the time to join us today. We appreciate it and hope that you have found it informative. An evaluation will pop up once you leave the session, but before you do, please type any questions into the chat box you may have. Thank you.
Hi all, it's Mel Wilkinson. We do have one question for you, Renee. Can you advise on general routine cleaning for practices?
Okay, yeah, sure. The Department of Health has a resource which outlines the principles for cleaning requirements for routinely touched surfaces and minimally touched surfaces, called the Environmental Cleaning and Disinfection Principles for COVID, and that can be found on the Health Pathways website, I believe, under COVID, practice management, and then infection control practice setup.
Can you see the screen, Renee, that I've put that on?
What was that, sorry?
Can you see health pathways where I'll put that up on the screen?
Oh, yep, perfect, yep.
It's here, practice management, infection control, practice setup, and then you click here, and that gets you through to this document, which has got all the latest information.
Yep, that'll be really useful for practices.
Yep.
Thank you.
Okay, that was fantastic. Thanks to the presenters for presenting today. We'll come to the conclusion. If you've got any further questions, please feel free to email them through and the girls will respond to you as we're out of time now. So thank you everyone for joining. Good afternoon.